Hi everybody, my name is Dr. Shadi Tabai. I'm a naturopathic doctor and women's health and hormones expert. In today's video, I'm going to tell you the major differences between synthetic and bioidentical hormones and which one tends to work better for menopausal care. Hormone therapy for menopause involves using estrogen and progesterone. However, they can come either in synthetic or bioidentical form. So let's go through the major differences between the two. The first major difference between the two is the structure of the hormones. Bioidentical hormones look structurally identical to the hormones found in our body. This includes hormones like estradiol, estriol, and micronized oral progesterone. Synthetic hormones, on the other hand, are not identical to the hormones in our body, but they look structurally similar. So things like conjugated estrogen and progestins are hormones that are considered synthetic. Second major difference is the source that we get the hormones from. Bioidentical hormones are derived mainly from plant sources like soy or yam, whereas synthetic hormones are mainly derived from non-plant sources like horse urine. The third major difference is the regulation of these hormones. Synthetic hormones are always being regulated federally by the government, which means that the dosages are going to be exactly the same every single time, and that there's oversight from the federal agencies to make sure that these products are going under good compliance. Bioidentical hormones can either be prescription regulated products or they can be compounded products. Prescription regulated bioidenticals go under the same scrutiny as the synthetic hormones, so they're well researched, the dosage is the same, and the federal government looks over them. Whereas the compounded bioidentical hormones, they're not as well researched, and the dosages may not be the same every time, and they're not regulated by the federal government. The compounded bioidenticals include things like biest or triest. These are bioidenticals that are not well researched and they're not federally backed. And usually insurance companies don't cover these products either. The major difference is their birth control potential. Bioidentical hormones don't provide the benefit of preventing pregnancy, whereas synthetic hormones can be used as an effective form of birth control. The last major difference between synthetic and bioidentical hormone therapy is their effectiveness for the treatment of menopausal symptoms. Both the synthetic and bioidentical forms of estrogen are effective for the treatment of menopausal symptoms. However, what we see is that it's more effective and safer when we use these forms topically rather than orally. On the other hand, synthetic progesterone is not the same as the bioidentical form of progesterone. The bioidentical form is much safer than the synthetic form, and so I usually do recommend using the bioidentical form, which is oral micronized progesterone. So it turns out there are some major differences between bioidentical and synthetic hormones. There's differences in their chemical structure and where they're sourced from, in their regulation, in their effectiveness, and in their birth control potential. I hope knowing these differences will help you determine which form is right for you. Let me know in the comments below if you are on hormone therapy, and if so, if you're on the synthetic or the bioidentical, and why you chose either one. And make sure to like this video and subscribe to my channel, because every week I'll be posting new content to help you with your hormones and with your health.